Top 3 common causes of arthritis in senior health tips. Have you ever woken up with aching joints and wondered, is this just aging or something more? What if I told you that millions of seniors suffer silently from arthritis every day and many don't even realize what's really going on inside their bodies? Arthritis isn't just about pain. It's a complex condition where your joints, the parts that help you move and live freely, start to break down or get attacked from within. In this video, we're going to uncover the top 3 common causes of arthritis in seniors, with information carefully fact-checked by health professionals to give you the most reliable and up-to-date insights. Stick around, because near the end, I'll share a powerful, surprising tip that can help protect your joints and ease discomfort, something many doctors wish more people knew about. If you want to understand arthritis better and take control of your joint health, this video is for you. Let's dive in. Number 1. Osteoarthritis, wear and tear arthritis. Let's talk about osteoarthritis, which is the most common type of arthritis among seniors. You might have heard it called the wear and tear arthritis because, well, that's exactly what it is. It happens when the protective cartilage that cushions the ends of your bones gradually wears down over time. Imagine that smooth padding between your joints slowly thinning out. Without it, your bones start rubbing against each other, and that's when pain, stiffness, pruritus, and swelling can creep in. Now, osteoarthritis isn't just about feeling a little stiff after waking up or after sitting too long. It's a condition that can affect your daily life in significant ways. But here's something important to remember. It's a natural process that happens as we age, and while it can be frustrating, it's not the end of the road. There are plenty of ways to manage it and keep living a vibrant, active life. You see, our joints go through a lot of stress every day. Think about it: walking, bending, climbing stairs, or even just standing. These simple activities put pressure on your joints. Over the years, that pressure slowly chips away at the cartilage. The joints most commonly affected by osteoarthritis are the knees, hips, hands, and spine. These are the areas that bear a lot of weight or get repetitive use. One thing many people don't realize is that osteoarthritis isn't caused by inflammation like some other types of arthritis. Instead, it's more about the mechanical. Those signs often come as a result of the body reacting to the damage. Breakdown of the joint. But that doesn't mean you won't feel inflammation-related symptoms like swelling or warmth around the joint. You might be wondering, why me? Why am I dealing with this now? Well, there are several factors that can increase your risk. Age is definitely the biggest. As we get older, the cartilage just isn't as resilient as it once was. But there are others too. For example, if you've had an injury to a joint in the past, maybe a sports injury or a fall, that joint could be more vulnerable to developing osteoarthritis later on. Being overweight is another major factor because extra weight puts additional pressure on your joints, especially your knees and hips. Also, genetics can play a role. Sometimes arthritis runs in families, so if your parents or grandparents had it, you might be more likely to experience it too. And then there's the fact that women are generally more prone to osteoarthritis, especially after menopause, due to hormonal changes that affect joint health. But let me tell you this. Just because you have risk factors doesn't mean osteoarthritis will control your life. There's a lot you can do to help protect your joints and reduce symptoms. One of the best things is staying active. I know it might sound a little counterintuitive if your joints hurt, but regular, gentle exercise actually helps keep your joints flexible and strengthens the muscles around them. strong muscles act, and don't forget about shock absorbers for your joints, making everyday movements easier and less painful. Low-impact activities like walking, swimming, or biking are great options. Stretching and flexibility exercises, they can help reduce stiffness and improve your range of motion. If you're unsure where to start, a physical therapist can design a program tailored just for you. Another important aspect is weight management. Losing even a small amount of weight can significantly reduce the stress on your joints and decrease pain. It's not about drastic dieting, but adopting sustainable, healthy eating habits that support your overall health and joint function. Speaking of diet, there's growing evidence that certain foods can help reduce inflammation and support joint health. Think about incorporating more fruits, vegetables, whole grains, and healthy fats like omega-3s found in fish, nuts, and seeds. These can help nourish your body and may ease some of the discomfort. Managing osteoarthritis often requires a combination of approaches, including medication when necessary. Over-the-counter pain relievers or topical creams can help ease symptoms. And in some cases, doctors might recommend other treatments, like corticosteroid injections or physical therapy, to help you feel better and maintain function. It's also important to listen to your body. If a certain activity causes pain, don't push through it. Find ways to modify your movements or try alternative exercises. The goal is to keep moving without causing more damage. Living with osteoarthritis means adapting, but it doesn't mean giving up on the things you love. Many seniors with osteoarthritis lead full, active lives. It might take a bit of trial and error to find what works best for you, but with patience and the right approach, you can manage your symptoms effectively. Remember, you're not alone in this journey. Millions of people experience osteoarthritis, and there's a strong community and plenty of resources out there to support you. The key is to stay informed, proactive, and positive. Your joints might be wearing down, but your spirit doesn't have to. So if you notice persistent joint pain, stiffness, or swelling, don't ignore it. Talk to your healthcare provider. They can help you confirm if it's osteoarthritis and develop a personalized plan to manage it. The sooner you take action, the better you'll feel in the long run. Ultimately, osteoarthritis is just one part of your story, not the whole story. With the right care and mindset, you can continue to enjoy your favorite activities, stay independent, and live life on your own terms. Your joints may show their age, but your heart and determination, those stay forever young. Number 2. Rheumatoid arthritis, autoimmune arthritis. Now, let's dive into something a little different from osteoarthritis, rheumatoid arthritis, or RA for short. This type of arthritis isn't caused by wear and tear. Instead, it's an autoimmune condition, which means your body's immune system, which normally protects you from infections, starts attacking your own joints by mistake. It's like your body gets confused and thinks your joints are invaders, so it launches an attack, causing inflammation, pain, and swelling. One of the tricky things about rheumatoid arthritis is that it often affects joints on both sides of the body symmetrically. So if your right wrist hurts, chances are your left wrist might feel it too. This symmetrical pattern can help doctors distinguish RA commonly targets smaller joints. First, think about your fingers, wrists, and toes RA from other types of arthritis, though it can affect larger joints as well. The inflammation caused by RA doesn't just stick to the joints, it can also affect other parts of the body like your skin, eyes, lungs, and even your heart. So it's truly a condition that can impact your whole body, not just your joints. You might wonder why your immune system suddenly turns against you. The truth is, the exact cause of RA isn't fully understood yet. Researchers believe it's a mix of genetics and environmental factors, like infections or smoking, that might trigger this misguided immune response. It's also more common in women than men, especially in middle age or later, but it can happen at any age. The symptoms of RA can come on gradually or suddenly, and they often include joint pain, swelling, stiffness, especially in the mornings, and fatigue that can make even simple tasks feel exhausting. The morning stiffness can last for hours, making it hard to get moving. If you're experiencing these symptoms regularly, it's important to take them seriously and talk to a healthcare provider. One of the key things to understand about RA is that it's a chronic condition, meaning it lasts a long time, often a lifetime. But here's the good news: with modern treatments, people with rheumatoid arthritis can manage their symptoms effectively and maintain a good quality of life. Early diagnosis and treatment are crucial because RA can cause joint damage and deformities if left untreated. The inflammation gradually wears down the cartilage and bone inside the joint, leading to pain and loss of function. But with the right treatment, you can slow or even stop this damage. Treatment usually involves medications that reduce inflammation and suppress the overactive immune response. These include disease-modifying anti-rheumatic drugs, or DMARDs, which can be oral pills or injections. There are also biologic drugs, which are newer medications designed to target specific parts of the immune system causing the problem. Your doctor will work with you to find the best option based on your symptoms and overall health. Besides medication, lifestyle changes can make a huge difference. Regular, gentle exercise is incredibly important for people with RA. It helps keep your joints flexible, strengthens muscles, and reduces stiffness. I think swimming, yoga, or walking low-impact activities that don't stress your joints but keep you moving. Stretching and range of motion exercises can also improve joint function and ease stiffness. Rest is equally important. When your joints flare up and feel painful, giving yourself permission to rest is essential. It might be tempting to push through the pain, but that can make things worse. Listen to your body and balance activity with rest. Another key factor is managing stress. Chronic conditions like RA can be physically and emotionally taxing. Stress can actually trigger or worsen flare-ups. So finding ways to relax, whether it's meditation, deep breathing, hobbies, or spending time with loved ones, can help keep your symptoms under control. Nutrition also plays a role. While no specific diet can cure RA, eating a balanced diet rich in anti-inflammatory foods like fruits, vegetables, whole grains, and omega-3 fatty acids from fish can support your overall health and may help reduce inflammation. Living with rheumatoid arthritis isn't just about managing physical symptoms, it's about taking care of your whole self. That means paying attention to your mental health, staying socially connected, and advocating for your needs. Support groups, whether in person or online, can be a great resource for sharing experiences and tips. It's completely normal to feel overwhelmed or frustrated sometimes. Chronic pain and fatigue can take a toll on your mood and motivation. But remember, you are more than your diagnosis. You are resilient, capable, and deserving of a fulfilling life. Technology and research are advancing all the time. New treatments and therapies are being developed, offering hope for even better management of RA in the future. Staying informed and working closely with your healthcare team can help you take control of your condition. If you're watching this and wondering if you might have RA, maybe you've noticed persistent joint swelling, pain, or morning stiffness lasting more than an hour, it's a good idea to reach out to a doctor. Early testing can make a huge difference in preventing long-term damage. Living with rheumatoid arthritis means learning to adapt, but it doesn't mean you have to give up on your goals or joys. Many people with RA continue to work, travel, and pursue their passions. It might mean pacing yourself and finding new ways to do things, but that's part of what makes you strong and resourceful. Your journey with RA is unique, and so is your strength. Every step you take to care for yourself, whether it's a walk around the block, a visit to your doctor, or simply taking a moment to breathe, is a powerful act of self-love. So embrace your courage, seek support when you need it, and keep moving forward. Rheumatoid arthritis may be part of your story, but it doesn't define your spirit or your potential. You've got this. Number 3. Gout, crystal-induced arthritis. Let's talk about gout, a type of arthritis that's a bit different from the others we've discussed. You might have heard it called the disease of kings or rich man's disease back in the day because it was linked to diets high in rich foods and alcohol. But today we know gout can affect anyone, especially seniors, and it's important to understand what's really going on so you can manage it effectively. So what exactly is gout? At its core, gout is caused by the buildup of tiny, sharp crystals in your joints, specifically a substance called uric acid. Normally, uric acid dissolves in your blood and leaves your body through your kidneys and urine. But sometimes your body makes too much uric acid or your kidneys don't get rid of enough. When that happens, uric acid can form crystals that settle in your joints, causing sudden and intense pain, swelling, redness, and warmth. Imagine tiny shards of glass irritating the lining of your joint. That's the sensation many people describe during a gout attack. Gout most often targets the big toe, but it can also affect ankles, knees, wrists, fingers, and elbows. One hallmark of gout is that attacks often come on suddenly, frequently at night, waking you up with sharp, throbbing pain. These flare-ups can last for days or even weeks if untreated, but the pain is often so severe it pushes people to seek care quickly. You might be wondering why uric acid builds up in the first place. There are several reasons. Genetics play a role. Some people are naturally predisposed to higher uric acid levels. But lifestyle factors are also very important. Diets high in purines found in red meat, shellfish, sugary drinks, and alcohol can increase uric acid production. Obesity and certain medical conditions like high blood pressure, diabetes, and kidney disease can also raise your risk. It's also worth mentioning that some medications can increase uric acid levels. Diuretics, often prescribed for high blood pressure or fluid retention, are a common example. So if you have gout or high uric acid, it's important to talk with your doctor about all your medications. Now, if you've experienced a gout attack, you know it's not just pain, it's a real disruption. Simple things like walking or wearing shoes become difficult. And if gout isn't treated properly, over time, those uric acid crystals can cause permanent joint damage, leading to chronic arthritis and nodules called tophi, which are lumps of crystallized uric acid that can form under the skin. But here's the good news: gout is very manageable. The key is early recognition and treatment. During an acute attack, doctors often prescribe anti-inflammatory medications to reduce pain and swelling. These might include non-steroidal anti-inflammatory drugs, NSAIDs, corticosteroids, or colchicine. Taking these medications as directed can bring quick relief and help you get back to your daily activities. Beyond treating flare-ups, managing gout long-term is about controlling uric acid levels. This might involve lifestyle changes, like adopting a diet low in purines. That doesn't mean giving up all your favorite foods, but being mindful of what you eat can make a big difference. Incorporating more fruits, vegetables, whole grains, and low-fat dairy can help, while cutting back on red meats, shellfish, and sugary beverages is a smart move. Staying hydrated is another important piece of the puzzle. Drinking plenty of water helps your kidneys flush out excess uric acid more efficiently. Plus, maintaining a healthy weight can reduce stress on your joints and lower uric acid levels, improving your overall health. In some cases, your doctor might recommend medications that lower uric acid production or help your body eliminate it more effectively. These medications can prevent future gout attacks and protect your joints from damage. It's important to work closely with your healthcare provider to find the right plan for you. Another thing to keep in mind is that gout isn't just a joint problem. It can be linked to other health concerns like heart disease and kidney problems. Managing gout well means taking care of your whole body, not just your joints. Living with gout requires awareness and adjustments, but it doesn't have to limit your life. Many seniors with gout continue to enjoy their hobbies, social activities, and daily routines by staying proactive and informed. If you ever notice sudden, intense joint pain, especially in your big toe, don't ignore it. Early treatment can prevent complications and make a huge difference in your comfort and mobility. Reach out to your healthcare provider and get the support you need. Remember, managing gout is a journey, but you're not alone. Millions of people live well with gout every day by staying informed, making smart lifestyle choices, and following their treatment plans. So take heart, you have the power to reduce pain, protect your joints, and live your life fully. Gout might be a challenge, but with the right approach, it's one you can overcome. Keep moving forward, and know that every positive step you take is a victory for your health and happiness. Summary. To wrap things up, we've explored the top 3 common causes of arthritis in seniors: osteoarthritis, rheumatoid arthritis, and gout. Each type affects the joints differently, but the good news is that with the right knowledge and care, you can manage symptoms and protect your mobility. Remember, arthritis doesn't have to control your life. You have the power to take proactive steps, from staying active and eating well to seeking medical advice early. But thank you so much for watching. If you found this video helpful, please give it a thumbs up and share it with someone who might benefit. Don't forget to subscribe for more senior health tips that empower you to live your best life. And remember that powerful tip I teased? Here it is: staying hydrated and maintaining a healthy weight can dramatically reduce joint stress and ease arthritis symptoms. Small changes can make a big difference. Take care of your joints and take care of yourself. See you in the next video.